Hi, I'm Michelle Collins and I'm a patron of PEDS, which is an eating disorders charity. Over the last year and a half, I've been working with PEDS and making a documentary about eating disorders. Here I'm interviewing Mandy and Sue from PEDS.
Hi, I'm Sue. I'm a specialist eating disorder nurse working for PEDS. I'm one of the founders and I set it up with Mandy.
Hi, I'm Mandy. I'm a registered mental health nurse by background, specialist eating disorder nurse, and one of the co-founders of PEDS. PEDS was set up in April 2014. It's a specialist eating disorder charity to help sufferers and their families. So to provide early intervention, to raise awareness, and to enable the person who is experiencing an eating disorder to get help at the earliest possible opportunity. When I was a teenager, 13, I developed anorexia. I wasn't aware at the time. I thought I was just being a little bit healthy, and I got very into exercise and cutting down on food. It turned into a full-blown anorexia, at which I was hospitalised when I was about 13 and a half. I've been one of the lucky ones. I went on to learn to manage my symptoms and basically decided that I wanted to do something with the care and treatment and support that I'd had, and also to try and help other people with their own experiences. I went on to do my nurse training at university and went to specialise in eating disorders, and that's where I met Sue working at the inpatient unit in Cambridge for children and young people.
And how is PEDS funded? So you're a charity stroke NHS. How does that work?
So when we set up, we were purely volunteers. We didn't receive any funding, and bit by bit we've built contracts and relationships with the local area. So we have a contract with the local CCG, which is Cambridgeshire Clinical Commissioning Group, and we have a contract with the local university, which is, for us, it's Cambridgeshire or Cambridge University. That doesn't cover everything that we need to cover in a day in terms of overheads and growth and expansion of the charity. So we rely heavily on fundraising and donations to support us, and also to meet the demand, especially since COVID, because we're seeing more and more referrals, and the people that we're funded for doesn't cover the amount of referrals that we're getting.
So do you think the pandemic has had a massive effect on eating disorders?
Absolutely. We've seen the numbers grow so quickly. We're about 500% more than we were before the pandemic. Wow. In referrals.
And it's daily.
Yeah.
We're getting people contact every day. And from all walks of life. We are having more referrals from the local Muslim community recently, which there's two ways of looking at it. One way I think is really positive, that people are coming forward for help, but I think more people are being affected by eating disorders, and that's obviously not so good. We're having more men, definitely more young guys, and more transgender patients coming to us.
We also have the privilege of getting to know our patients well, so it's not just so many sessions and that's it. We get to know a lot about them so we can help them more. We also show them that there is definitely potential for them to recover, and it may take time, but if they keep moving forward, we will stay moving with them. So we don't just offer so many sessions and then walk away.
How do you think the NHS can change their attitude towards eating disorders? What can they do to make things better?
I think one of the areas that is extremely hard is the BMI, and when the NHS look at the BMI and tell people they don't meet their criteria, somebody with an eating disorder hears that as "I'm not ill enough," so they then go and make themselves worse. We have had hundreds of people that have done that.
And that's really hard because you can see it from both sides. So when people are overwhelmed, services are overwhelmed, NHS is at maximum capacity. So they have to have some kind of threshold because they can't take on every single person because they can't meet that demand. Very much I think about the wording to a patient. If someone goes to a GP, and this is where understanding and education is so important, because if you go to a GP and the GP tells you your BMI is absolutely fine but doesn't listen to the fact that you are a male and you've lost 6 stone, or that you're eating 800 calories a day and burning off 1200, then that person is just going to hear, my BMI is fine, what am I doing here? I can't even do this right, I'm a failed anorexic.
So the youngest person we have seen is a 4-year-old. They had been copying somebody at school who was teaching them how to put their fingers down the throat, and they got it from their mother. The eldest person was 83, and she'd been binge eating all her life and thought that was normal, but now realised it wasn't and wanted to stop. We've seen a 70-year-old, again, who was binge eating, who was in tears because she just couldn't stop. And you think, bless her, at that age, you really shouldn't need to be worried about things like that.
It's about having a collaborative pathway and about working together with services. So we do work really hard with the local eating disorder Cambridgeshire team to have a joined up approach. So if a patient goes to them, if they don't meet the criteria, then the GP can say, well, I don't think it's appropriate for you to attend this clinic, but this clinic, i.e. PEDS, would be more suitable for you. If we can do that, and we can do that around the country, and other teams can do that, then you're giving a joined up approach, and you're not just saying that this person isn't ill enough.
So it's about working together.
Absolutely.
Yeah.
And do you think it's worrying what is happening with this increase in eating disorders in this country?
It certainly is. And I think if you look back, a few years, they were nowhere near the numbers that there are now. So whether it's people are coming forward, which is a positive thing, or whether it's because things like the pandemic have caused people to want to take control of their life, like you said, and this is the one area, but it is extremely worrying, and it's got the highest mortality rate of any mental health illness.
And I worry about the effect of social media,
Yeah.
because I think more and more young people are being affected by what they see, what they read, having to conform, having to have this perfect profile picture, having to lose weight. And the competitive side of that is really triggering for a lot of people. And then you add that to the COVID pressures and the government saying, you need to go out and do 1 hour's exercise a day. And if you're thinner, you're not so much at risk of COVID-related symptoms. People then, for eating disorders, people use that as right, I must keep my weight down, I must keep my exercise up. Massive impact. There needs to be, in terms of capacity, there needs to be more specialist eating disorder nurses around the country. We're at maximum capacity now. And it's such a secretive illness as well. There's still this, we're trying to change that, but people still say that they feel ashamed to tell someone, or ashamed to admit that they've got an eating disorder because they've lost control, or they feel that, they could have or should have handled things better. So there still is those misconceptions and lack of understanding, and that's where training and awareness is so important. And for people like medics, so GPs that are coming into training, they're the people that need to have the training and support, because they're the eyes and ears to picking up for early intervention. Sue mentioned earlier, eating disorders have the highest mortality rate of any psychiatric illness through either suicide or the physical complications, i.e. cardiovascular. So they're pretty serious.